All right, good morning, everyone. Welcome to another virtual question and answer session. My name is Scott Evans. We are at Wesley Medical Center this morning. I am joined by three fabulous women. So, I think there we go. We can fit all in here right now. To my immediate left, I have Lee Pham. She's the manager of rehab services. Then I have Erica Reinecke. She's with speech therapy, a speech therapist. And then I have Chris Reed, who is the director of rehab services. My head is getting cut off, which is fine. We have a great virtual Q&A for you today, talking about occupational therapy, physical therapy, and speech therapy. So thank you for those who submitted questions.
Oh. The beauty of working in a hospital.
Yes, yeah, the fire alarm is going off. Usually it's a test right now because of construction. So we'll do our best to talk loud and over that. Oh, man. There we go. There you go. So I'll have each of them introduce themselves, but before they do, just a reminder, there's a evaluation that we'd like for you guys to fill out. At the end of this, your teacher should have a copy of that. Those are always appreciative so we can get feedback from you. The other thing is we are looking to do a virtual Q&A for seniors. We're working on the timing of that. And then we'll do another one for juniors at the end of the school year or after the school year is finished. But the career launch for seniors we're looking to do before school ends. And that's going to be specifically for students who want to get a job at Wesley starting in the summer and they're looking to go to a local college or university. So we'll get you more details on that. We are still working to finalize the minute details on that. So we'll get that out to you. So without further ado, ladies, if I could have you each kind of tell us a little bit about yourself, what you do, because you're a physical therapist, you're an occupational therapist. So we'll talk about those differences. So I'll let you take it away. Thank you.
Hey everyone, my name is Lee Pham. Like Scott said, I am a physical therapist here at Wesley Medical Center. I am also the manager of rehab services. A little background about myself. I am actually from Wichita, and I am a product of Wichita Public Schools. I went to Southeast, go Buffaloes. So a little bit about myself as far as my career goes. I went to Southeast for high school, went to Wichita State for undergraduate degree, got my degree in exercise science, and then I went on to physical therapy school at Wichita State as well. And that's a 3-year program. It's a doctorate program. So you do 4 years of your bachelor's degree, and then you move on to 3 more years to get your degree in physical therapy.
My name is Erica. I'm the speech therapist here at Wesley Medical Center. I am not from Wichita. I grew up in a town of about 500 people. I graduated there. I went to Kansas State University where I got my undergraduate degree in communication sciences and disorders. And then I went and got my master's degree at Wichita State. So it was a 4-year bachelor's degree, 2 years for a master's degree. I've been out for about 10 years now, and I've worked in multiple settings, outpatient, inpatient, acute care, and I've enjoyed all of it.
And I'm Chris Reed. I'm the director of rehab services here at Wesley. I'm an occupational therapist. I've worked at Wesley for about 11 years. I grew up in Oxford, Kansas, about an hour south of here. Did my undergraduate degree at K-State, got my bachelor's degree in kinesiology, which is exercise science, and then went to KU for OT school. It's an entry-level program, so you don't have to have a degree before you go in, but I did. So I spent 3 years in Kansas City, going to KU, and here we are. So probably a good thing to start off with is just explaining to you what the differences are between PTOT and speech therapy, which I think maybe the best way to do that is just to tell you what we do, and that'll kind of explain itself. So, I can get started. Yeah. So physical therapy, in the grand scheme of things, we work on getting people back to their prior level of function, whether it's an injury or some pain. You can come to us, we assess you, we look at your whole body, we look at your muscles, we look at your range of motion, which is how flexible you may or may not be, where your pain might be caused, where your pain might be located, and then we make up a plan of care to see what we can do as far as exercises go. We have different modalities, so there's like hot packs, electrical stimulation, weight training, all the things, so we can get you back to where you were before.
There are several settings that you can work in as a physical therapist. So there's the hospital setting, which is where we are now. You can do outpatient clinic, which is where a lot of people are familiar with physical therapy. There's also, you can work in the school system, you can work in a nursing home, or you can work in what's called home health, where you go to the patient's home to do exercises and strength training. So we work with, as far as the acute care setting, which is the hospital setting, we work with tons of diagnoses. So you can be in a car accident, you can just come in for a simple stomach pain, and we will work with you to see what we can do to get you stronger, get you out of the bed, get you to be able to walk. We use things like walkers, crutches. We have TheraBands, little elastic bands that you can use for strength training, and that's the gist of physical therapy in the hospital setting.
Yeah. Okay. Oh, so for occupational therapy, we get pretty confused looks when we try and explain what we do to people. So occupational therapists don't work on rehabbing people for work. So this is going to sound really corny, but it's what occupies your time. So we're really focused on the tasks that you're doing. So where Lee's looking at, fixing function through exercise and other things, we really focus on task-based activities to rehab people. So if someone, someone wants to have a stroke and not able to use the left side of their body, where Lee would work maybe on trying to rehab that side of their body to be able to regain the range of motion, strength, function. OTs can work on that as well, but our goal might be more on teaching you compensatory strategies, just different ways of doing things. So, how do you get yourself dressed without the use of that left side of your body? It's really, really a lot more focused on the task that you're trying to do. And then in different settings, it looks a little bit differently. So like we talked about, we work in a lot of different settings. So when you get into more of an outpatient setting, OTs might work more on upper body, fine motor coordination, where PTs might work more on lower extremities. In the hospital setting, we're working more on just your daily function stuff. So where PTs are working on getting out of bed and walking around and general mobility stuff, we're working on getting dressed. How do you, how do you get up and down from the toilet? Do you have the strength, coordination, activity tolerance to brush your teeth, those kinds of things. So it's really more task based.
So I am, like I said, the speech therapist, and like Chris said, our job title gets very confusing to people when I come in and introduce myself as a speech therapist. A lot of people will say, well, my speech is just fine. So our actual title is speech language pathology. We do deal with speech, but that's actually a very small part of what we do. I kind of base it off of what area of the body we focus on, and we focus on very much from here up. So in the hospital setting, we actually deal with a lot of swallowing disorders, which can be brought on for a variety of different things. A lot of them are strokes, traumatic brain injuries. So we deal with diagnosing swallowing disorders and then implementing plans or exercises, something that we can do to help improve their swallowing abilities, or we modify their diets. So that's a big thing we do in the hospital, but we also work on cognition. So anything that is going on in the brain. Again, for various reasons, traumatic brain injuries, strokes, dementia. We deal with memory, problem solving. How can we get you functioning at home or in whatever setting you're going to be in? Can we get you back to work? Like then we have a variety of settings that we can work in. So obviously here in acute care, we're working a lot with very newly diagnosed people with something new that's happened. And we work on trying to get them to a place where they can go on to the next level. So we work in an outpatient setting, inpatient rehab. You are probably most familiar with speech therapists that work in the school. What speech therapists do in the school is pretty different than what we're doing in the medical setting, but it's the same concept. Still working on ability to communicate, whether that's through different sounds that we're working on you acquiring, or your disability to communicate, comprehending language. So how do you follow directions? How are you able to answer questions? So anything that you can think of that deals with your thinking abilities, your brain, your throat, that's what we deal with.
I think, being in the hospital setting, people often think about doctors and nurses and patient care techs or CNAs. How do you guys feel like we collaborate with the nursing staff, and how do we differentiate ourselves with them?
I collaborate with nursing quite a bit here in the hospital. It's really important for us to touch base with nursing, especially when we're dealing with, again, swallowing, because they're going to see the patients every day. They're going to be watching them eat. So I touch base with them. How are they doing on, the diet that we put them on? Are they appropriate for therapy today? Are they really sleepy because they've had medications, or are they in a lot of pain? So nursing is really important, but to work with them, it's a really big team effort when it comes to caring for your patients.
I think what we're trying to do is, in addition to all the nursing care. So, nursing's trying to stabilize the patient, improve their medical condition, and we're trying to improve their functional condition. So, we're trying to help the patient grow so that they can participate in all the things that nursing's trying to do as far as their care. So, if we're able to, if a patient's not able to get up out of the bed to go to the bathroom, if they're having to use a bedpan, if we're able to help facilitate that, help them find a safe way to transfer over to something more appropriate, we're a support for nursing, I think, and they're a support for us. So we kind of all feed off of each other as far as providing that care to the patient. So we collaborate with a lot of different professionals in the hospital. So who do you guys talk to most often?
Probably case from a therapy standpoint, probably case management. So they're the ones that kind of coordinate where the patient might potentially go after they're medically stable from discharge from the hospital. So a big role for therapy is to see where they can go. So can they go home? Are they appropriate to go to a nursing facility? Do they need to go to what's called an inpatient rehab facility? So they like to look to us to see where we can get the patient while they're here in the hospital. And then, are they safe to go home if they can't walk, if they're living by themselves? What can we do here to get them back to that position? So we collaborate a lot with case managers with that.
Yeah, and as a speech therapist, I think from all the therapy standpoint, we probably deal with doctors more so than physical and occupational therapy. I talk to doctors, various doctors, nurse practitioners, physician's assistants daily. Mostly, again, dealing with swallowing, because that's a big barrier to getting people out of the hospital if they're not able to eat and drink safely. So we deal a lot with talking with doctors about our plan of care, what our goals are for specific patients, and how are we going to help them move or progress during their stay to get them discharged. So we do a lot of talking with doctors, which is a little different than some of the other disciplines in the hospital.
I guess talk a little bit about the day in the life. One of the questions we have is how fast paced is your position? And I think we all could probably say in the hospital setting it's very fast paced. So for all of us, for OT, PT, and speech, we have a list of patients that we are assigned every day. And you get that list, head to the floor, and you kind of run through your patient caseload. I would say in the hospital setting, it's a very autonomous job in that it's self-directed. So we do the evaluation of the patient ourselves based on what our scope of practice is. So I'm going to be looking at assessing all of those self-care skills, and I'm going to make the plan for how we're going to address those deficits that we might identify. And then, we communicate that through all of our documentation. And then we kind of direct that. So we'll get input from the physicians, we'll get input from the case managers. But I think that's one of the really cool things about therapy is it is very autonomous. It is somewhat self-directed. So you have a lot of control over what you're doing during your day. And then you have that ability to kind of dive into the areas of interest that you have and really focus in on those things that are your strengths. So,
what do you guys find are some cool equipment or things that you use to work with to see your patients?
We don't have a lot of like individual equipment, but we do get to do x-rays of people swallowing, which is kind of cool. We work with our radiology department, and it's basically like a live x-ray. So we watch people swallow live under a camera. So that's kind of one of the coolest things that we get to do. We also have the capability of doing scopes, where we stick a scope through your nose actually, and we push it back through your nose and down into your throat. It's not as awful as it sounds. So yeah.
I watched it.
Yeah.
It seems really awful. But
If you're
really well.
If you're trained well enough, it won't hurt. But we get to watch. We basically get to watch you under camera swallowing. And the purpose of those tests is to make sure that what you're eating and drinking is going down the right way. We don't want things going into your airway. We don't want you choking. So those are kind of cool things. Otherwise, we don't have a lot of cool equipment like PT and OT get to carry around. We do a lot of paper and pen work.
So I will speak for Erica on when you say you're modifying diets. One of the really cool things I think that speech therapists do is they'll thicken liquids. They'll modify like the texture of people's food, and they can make water with the
like a
gel powder mix. They can make water as thick as pudding, which sounds really gross, or honey. Yeah, it's very interesting how they do that. So I think you're selling yourself short. So
yes, we thicken things too. Yeah.
Well, speaking of equipment, Scott has a really cool video that we'll show you guys and kind of talk you through some of the equipment that we use on a daily basis, kind of around the hospital. So this right here is going to be a little preview of our outpatient clinic. So in our hospital, we have an outpatient pediatric clinic. And this first video actually, or picture, is our ortho floor. So we'll do stair training. People who have total knee replacements, total hip replacements, they'll do what's called group therapy. And so we'll have 3 to 4 candidates that are appropriate, and we'll just do exercises, walk them, do stair training all together. So this is a nice video of me demoing one of our recliner chairs. So for total knee and hip patients, it's important for them to work on range of motion. There's a lot of swelling. They cut into your muscles to kind of get to the joint to replace it. So it's important to have the appropriate equipment to do those exercises with them. It's also me struggling to put the chair back, so that's exciting.
glad we got that on video.
Yeah.
That was really nice. So this is the cardiac rehab gym. So part of rehab services includes cardiac rehab. So in the hospital setting, we do phase 1. So people right after they have heart replacements, physical therapy and occupational therapy will go in and start to rehab them pretty quickly, pretty early on, usually the day after they've had their chest cracked open. So, and then we follow them all the way through phase 2, which is the outpatient cardiac rehab. So that is more nurse and an exercise physiologist who run that program, but it's something that physical therapists can also get into. So it's a really nice continuum of care within the hospital. So. This is going into our outpatient clinic. So we'll use parallel bars during ambulation with patients, working on balance, working on gait. I'm not a PT, so I might be taking out of turn. So, and this is in our pediatric clinic. So we have a huge toy room. So one of the cool things is we use everyday activities, everyday tasks in a therapeutic way. So when people walk into our clinic and say, "Oh, this is really cool, you get to play with kids all day." Yeah, I mean, that's a lot of what we're doing, but the goal is really, really specific, really function oriented, task based. But I think that's one of the really cool things about our jobs is you have to be pretty creative and you have to be able to think on your feet. Because you can set up a plan for what you think is going to happen in a day, and you walk in the room and it's a completely different situation. So you have to be able to think critically. You have to be able to adjust. But we get to use some really cool stuff in the outpatient setting to do that. So in the hospital, it's pretty bare bones as far as you stick to what you got, and it's just trying to get people up and moving.
But again, the benefit of being in our profession, I feel like, is having that range of age that you can work with. So pediatrics, you can work as small as, you know,
In the NICU.
in the NICU, which is the neonatal intensive care unit, and then all the way up to, you know, patients who are 100, over 100. So there is a variety, and you don't have to always stick to one setting. So it's nice to have that flexibility, availability, to go between age ranges.
Yeah, I think that's, like she said, one of the coolest things about our jobs is you do get to not just pick maybe the age that you want to work with, but the setting that you want to work with them in. So obviously there's a little more job opportunities in certain areas. But if you want to work with pediatrics, but you like the medical side of things, there's job opportunities. Maybe you want to work in the schools, or maybe you want to you know, work with adults, but you want to work in outpatient. You know, there's so many areas that you can work in that it doesn't get boring, which is nice.
And if this is, I mean, if therapy is something that's interesting to you, as far as what we do, there aren't really specific entry-level positions, but there are opportunities to work as a rehab aide where you don't really need any education or training for that. And that,
Yeah, I started working at Wesley as a rehab aide myself. So I did that for 2 years. Like Chris said, it's entry level. You get your experience being in the therapy world. You get exposed to physical therapy and occupational therapy. Very rarely does speech therapy need an aide, but we are available also to help with equipment. But it was a great opportunity for me to see what it's like and get some experience under my belt before applying to PT school.
yeah, and
So,
it gives you a chance to see what the differences are. So most people are familiar with physical therapy, but you know, that was my plan going into it. I was going to go into physical therapy school, and then I hurt my knee and went through physical therapy, and I was like, maybe not. And then I found out about occupational therapy, and it really fit for me. So as far as entry-level positions, not a ton, but as a rehab aide, you can work in a couple different settings in that capacity, just to get a feel for what you're getting into.
and also, if you're not interested in being committed to, you know, 3 years of schooling, occupational therapy and physical therapy also have assistant programs. So there's a physical therapy assistant program and an occupational therapy assistant program. There's one here in town for occupational therapy, and there's a couple kind of in the surrounding Wichita area, but that's a 2-year associate's degree. And so what they do is they follow the plan of care from the therapist, the occupational therapist or the physical therapist. So the OT or PT will do their evaluation, do their assessment, develop this plan of care, and then the assistants generally will follow through with that. So they'll see them usually on a daily basis, do the treatments, and they'll consult with the evaluating therapist, you know, if they need to progress or if the patient's regressing, they can readdress goals. But it's really cool to have that option too if you're not looking for something to be long-term as far as schooling goes.
And there unfortunately isn't, there is an SLPA, speech language pathology aid program. I'm not as familiar with that because it's not very widespread. Some states don't even acknowledge SLPAs. And I've never seen them in like a hospital setting. Most of the time, if there is an aid, a speech therapy aid, it's usually in the school setting. So there is not really many entry level opportunities for speech therapy. You're kind of in it for the long haul if you want to do what we do.
Are you guys able to specialize in anything for your professions?
In speech therapy, you know, obviously we all go through the same schooling. There are different, I don't know if you wouldn't call them certificates, but through our national organization, you can specialize, like you can become board certified in certain areas. So a lot of people in the hospital setting will become board certified swallowing specialists. I've seen people who are specialists in fluency, which is for like stuttering, or board certified specialists in autism. So it just requires a little extra continuing education, so taking more courses, but there are ways you can specialize in certain areas.
Same. There's board certifications for OTs and PTs alike, kind of in those areas that you work in more often. And then there are other like specialist certifications you get through other national boards. So there's a lot of opportunity to specialize in something if that's what you're interested in. So
I think that's a great opportunity because you can do for physical therapy. I'm assuming OT is like that as well, but there's fellowship and residency programs you can do. So you have to have X amount of hours of experience, and then you apply to this other program. So you can get a specialty in acute care, which is the hospital setting, or even ICU. A lot of people are familiar with sports medicine. You can do orthopedics, geriatrics, so any type of specialty niche in the medical field, you can get a specialty in that. So that's pretty cool. So, so to kind of ask them questions or kind of give them some information, what advice do you have for high schoolers?
Okay, so it's a long list. No, okay, so if you're interested in getting to the therapy world, my advice would be to spend some time doing some observation if you can, so that you can get exposure to the different areas. So I will say growing up in a very small town, there wasn't a lot of exposure to a lot of different opportunities as far as the medical field goes. So doctors, nurses, PAs, that was about my exposure when it came to medical careers. I knew about speech because, you know, there were speech therapy services in our schools, but that was really about it. So my advice would be to do some observation, get out there and see kind of what there is, what the different areas look like.
And if you know for sure you want to be in like a hospital setting, just try and find those entry-level jobs, whether it's a rehab aide or like a unit clerk, just to get that exposure to all the different disciplines. Because especially as a unit clerk, you see all about pharmacy, respiratory therapy, you know, what else there is. I don't even know. But anyway, so those entry-level positions would be great exposure and to see if it's something you're interested in. I mean, you also have to have a pretty strong stomach if you want to be in the hospital setting specifically, because there are some very unique situations that you might not be ready for. So.
Yeah. And you have to be able to work with people. I mean, a lot of people want to get into the medical field because they want to help people and get that feel-good feeling from helping people. And I will tell you, that's not what our day is all day, every day. It's not, you know, you're going in, somebody's been in a car accident, they've got multiple broken bones, they've just been through surgery. Our job isn't to go in and make them feel great. Our job is to go in and help them progress, and that'll fill your cup up if you've got the right mindset. But if you're looking for a feel-good feeling, that's not always what you get from the services that we're providing. It is kind of dirty work. You are pushing people past what they want to be doing.
You will get cussed out.
Yeah.
You will get refusals. But if you can, educate them is really important on what your role is, what their goal is. You can usually be successful.
I guess, do you guys have any questions for us since we've been rambling for a while now? Anybody out there? You are?
Yeah, give me a second to. While they're thinking, do you guys want to talk about competitiveness of the programs to get into them?
Yeah. So they are. There are.
Tell them what.
Oh, okay. So competitiveness of the program. So how to get into school. I will say in the state of Kansas, there are not a lot of. There's only one occupational therapy school. That's KU. That's the only opportunity you have if you want in-state tuition, which is what motivated me to go to KU after the joys of going to K-State. So for OTA programs and PTA programs that are kind of local, those are very competitive to get into. Most classes are 32-ish students per class. How many did you have in your PT class?
I had to run around 30,
Yeah.
but it might have been increased now that the PT program at Wichita State has expanded their location, so they might be able to accommodate more students.
And how many? There's 2 PT schools in Kansas.
There is KU Med and Wichita State.
Okay. And then.
Yeah, for speech therapy, it's probably very similar to PT and OT. I mean, it is competitive. You have to have decent grades. You have to show that you've been involved in different things. They want to see kind of a well-rounded person when you're applying to get into the next level. So that, during your undergraduate degree, that's when you want to kind of shine, I guess. And then when you get into your master's or doctorate level programs. So in Kansas, there are 4 schools that offer the master's degree for speech therapy, and Wichita State is one of them. K-State, KU, and Fort Hays all have programs. There's good programs. All of them are good programs. They all offer something a little bit different. I think Fort Hays is probably one of the smaller ones, programs, but I would say probably maybe 20 to 30 people in each program. I think KU is maybe one of the bigger ones. And my class specifically had around like 25 when I graduated. So I think they're all around that same number still. So it is competitive, but it's very doable.
Yeah. I mean, a little personal story for me, I applied to KU Med Center in Wichita State, and I didn't get into KU Med, which was my #1 school. So that was a little humbling experience. But I was on the waiting list for Wichita State, and luckily was able to get in that same year. So if you are interested in any of these programs, don't give up, try your best if it's what you want to do. You'll be able to do it. So
I think some things you can do to kind of set yourself apart when you're applying to school is make sure you have, you're required to have observation hours. But one of the things for OT was you could either have observation hours or you could have working hours with a special population. So, working with people with intellectual disabilities, developmental disabilities, spend some time working with the populations that you're going to serve. And that'll help set you apart. And then also, it was surprising to me when it came down to doing interviews for school, but writing, you have to be able to write well. We had to do a writing sample during our application to OT school. So the first half of it was interviewing with a group of people. So you have to have people skills, you have to have writing skills. So that was one of those things going into it I hadn't expected was to have to be able to write well.
Okay. Any questions yet?
All right. Yes. We'll throw a softball. What do you love most about your job or your career choice?
I think what I like most is a little self-gratification as well. But starting from the bottom, with the patients, especially in the ICUs, say for example, someone got in a really bad car accident. So being the first person in there to sit them up at the edge of the bed, that's, while it sounds silly, that could be a huge feat for some of these patients. So being able to see the progression from when they first got here in the ICU to maybe a couple of days later and they're walking down the hallway, even if it's with a walker, because a lot of times they start and they don't think they're going to make it. So it's nice to be able to be part of that process and get them stronger, get their endurance up, and see them succeed in the hospital setting, because a lot of times they're really down on themselves. They're in the worst case scenario. They might be ventilated, they have a breathing tube down their throat. But to be able to show some progression, they love it. I love it. And I think that's one of the more gratifying things about being in this job.
Yeah, I'm very similar with Lee. It's really cool to see the progress that people make. And yeah, being the first person in there to see where they're at, kind of at their lowest point, and seeing them progress. One cool thing about speech therapy is, again, we work with communication. So you have people who aren't communicating at all after a stroke, and you get to be the first person to get them to say something. And I've had family members crying in the room when you're getting a patient to say anything, even if it's as simple as singing happy birthday or counting to 10. That's the first time, in days where where family hasn't been able to hear the patient's voice. So that's really cool, being able to help people communicate, because honestly, being unable to communicate we communicate every day, all day long. Without your ability to communicate, it's difficult to do anything. So that's really cool about being a speech therapist is we help with being able to communicate, which is necessary in life.
I mean, I echo everything they're saying, as far as how cool our jobs are. I think the other really great thing about it is, you don't have to have a different degree to have a different career. So, for us working in acute care, it's a really, really awesome opportunity. This is where my heart is. I don't want to work in any other setting. But if I got to a point where this was not filling my cup up anymore, a school therapist, that job is a completely different career path. That's a completely different opportunity. And really, you just have to be able to show that you can, get the education through some continuing education to switch over to that. You don't have to reinvent your entire career, or your education process to get into another field. So outpatient looks different, schools look different, even skilled nursing facilities look different. So there's a lot of opportunity to grow. So.
All right, well, thank you very much, ladies. I'll jump back in for a moment, get my head. See, look, how about that? Thank you very much to all of them. Melody, any opportunity to ask any other questions if you have them real quick? If not, that's fine. Assuming no. While you're, go ahead and jump on, cut me off anytime. I know that growing up, I had a physical therapist through an ACL tear, through different injuries, and yeah, you get upset with them. But
They also call us physical terrorists.
the
So.
physical therapy, but the reality is that it's one of those that it's progression. It's like homework. You may not like it, but it's better in the long run. Speech therapy, my son needed it when he was a kid. He couldn't speak correctly, and she came over to our house, really kind of her, and within, I think, 1 or 2 sessions, he was speaking and doing well. Sorry, Chris, no occupational therapy story.
No worries.
Yeah. All right. So they mentioned observations. So I'm going to say this with, I'll say this. Melody, I know you've been asking about observations, getting students back in the hospital. Good news. As of Friday, our chief medical officer said that we are good to move forward with observations. The caveat is there are a lot of things we need to do to put in place to get that operational again. So Hope is working on that. And we'll let you know as soon as we do. I don't know if that's going to be something that we can do that's going to take a couple weeks or a month or what. So we'll be in communication with you on that. Students, please fill out the observations. Let us know what questions you still have, and I can put you in touch with them, or I can reach out and have them answer your questions. But those evaluations are helpful. If there's another area that you want us to expose you to, please let us know, and we'll work to do that again. And teachers, as you're watching this, please let us know. We still have 2 more planned for the rest of the year, one in April and one in May. The one in May may get in the way of finals, so we may drop that one. We'll see. We may just make it available to you end of April, and we'll do it that way. So thank you very much. We appreciate you guys.
Yes,
Thank you.
you. Thank you.
All right. Have a great day.